Now what happens in a goniotomy is this angle of the anterior chamber. So there is an angle formed in the anterior chamber and the trabecular tissues. We call that as the angle of the eye. Sometimes even that get closed due to adhesions, and now physician performs an opening into the angle of the eye so that the fluid drains out in order to treat the glaucoma as well, or in order to relieve the pressure that is formed in the eye. So this is called as goniotomy. When there are adhesions that are formed in the eye as a result of chronic inflammation, especially in the anterior compartment, or when we say in the anterior compartment, it is called as the anterior synechiae. Synechiae means adhesions. Posterior synechiae means the adhesions between the iris and the lens. Now there is something called as Goniosynechiae, where the adhesion is between the angle of the eye. So when the physician is going to sever, cut and remove those adhesions, we call that as Goniosynechiae or anterior synechiae, posterior synechiae removal.